Say yes to new beginnings.
Yes.
Say yes to new standards of excellence.
Yes.
Say yes to engaging reportage with a difference.
Yes.
Introducing Yes International Magazine.
All right, now, what do you like most about being a medical doctor?
That's very obvious. The most thing that I enjoy is that I am able to bring joy to the faces and to the mind of people, irrespective of what pain they go through. And it usually gives me a sense of fulfillment when I come across them outside and they say, "Thank you, doctor, for what you did for me," and all that and all that. That in itself is a joy that cannot be quantified in terms of money. So this is what I really love being
Okay.
a doctor.
Okay.
Yeah.
What don't you like about being a doctor?
Time consuming. Very, very time consuming if you want to be successful, either as a private doctor or even when you're in government. It is so time consuming, and you have to give it everything that you have, and not just time, but your passion. Whenever you are treating a patient, it's always on your mind until that patient gets well. You too are also suffering the same. So that in itself is very demanding, giving all your time, all your instincts, everything about you, you devote to the patient. Even when you are sleeping, you are still thinking about that patient that you left in the hospital. And that can be
Okay.
very, very
All right.
demanding.
Now, it's obvious that medicine or being a medical practitioner has done so much for you. What has it not done for you? What has that profession not done for you?
Looking back, I don't think there's anything it has not really done for me. Yes, it has taken much of time, much of money, much of that, but these are things that come along with being a good doctor. So I don't think I have any regrets at all for choosing
No
that
regrets at
profession.
all. I like that. I like that. Now, your medical facility is called ACE. The ACE medical clinics.
Yeah.
How did you come about that name? Why did you choose that name for your? Why did you choose that
Well,
business name?
I'll
Yes.
give you a little background to that.
Okay, sir.
I went into private practice, I think, in 1989 after a stint in the civil service. And the name that readily came to mind was Medicare clinics. Medicare in the sense that it is medical care. So Medicare was formed from medical and care, Medicare clinic, Medicare. Then the issue of clinics also came in. Well, naturally, one would have thought that it would be called Medicare clinic. But right from the start of that vision, I wanted it to have a sort of polyclinics, many clinics rolled into one. So that's how the Medicare clinics came about. But along the line, I think it was in 2007 when it became a limited liability company. When we applied for registration, disappointedly, we were told that Medicare clinics was already there. So we just had to put something extra to distinguish
Okay.
it from the existing one. So
Okay.
that's why ACE came in. So
Okay.
it's
Came into
ACE
the.
Medicare Clinics, now a limited liability company in
Okay.
2007.
Now, so how does it feel to own, to run, and operate, one of the biggest medical facilities in Ogun State, or to be specific, in the entire axis of Ogun State? How do you feel about it?
Naturally, I feel good, but then I also do know that it's not a solo effort. It's to the glory of God, number one, but more importantly, it's a combination and a culmination of the contributions of all our workers. I can tell you that we have full-time specialists in the hospital. We have a panel of visiting specialists, and it's also a thing of joy to know that we run almost all the specialist clinics. So the result of that is what we are seeing. It's not a solo effort, but rather a combination of the contributions and the passion of other workers, both doctors, nurses, pharmacy, and the other professionals, health professionals in the area. Besides that, also we invested so much in technology, which has also given us that little edge. So combination of human resources and technology is what has produced what you have there. But everything is to the glory of God, for which we are eternally grateful.
Okay. So what stands is Medicare clinics out? What distinguishes is, from all the other medical outfits, not only in Ogun State, but in Nigeria generally? What stands your own outfit out?
Well, I think that derives from what I've just spoken about. We have passionate workers who are devoting all their best to the vision that we have. And the vision of the hospital is to become a medical center of excellence. And that has been driving everything, every process, every activity that we do in Medicare clinics. So with that vision, which is bought by every worker, and with the investment in technology, and with the overall aim of patient satisfaction, I think these are some of the things that we pride ourselves in.
Okay. Now, what is your dream for ACE Medicare clinics?
Well, the dream is for that vision to continue. In medical practice, there's no zenith. Quality is a continuous thing. We aim to continue to improve daily and daily in quality. And we also have a vision that it will run in perpetuity, irrespective of whether I'm there or not. So that's my vision, to make it
Okay.